Hello, I'm Dr. Shruthi, consultant gynecologic oncologist at Cytecare Hospitals, Yelahanka, Bangalore. So today I am going to talk a bit upon gynecologic oncology, its relevance and its implications. So gynecologic oncology is the branch of oncology which involves cancer treatments that specifically deals with cancers of women's reproductive tracts. So this includes cancers of the uterus or the womb, as in colloquial language, the cervix, which is the lower part of the uterus, cancers of the ovary, cancers of the fallopian tube, vagina and vulva. So these are all parts of the women's reproductive tract. So it also includes the allied specialty, which is breast cancers, which we have a separate breast surgeon for. So as a gynec-oncologist, after my post-graduation in obstetrics and gynecology, I have further trained by taking a fellowship as well as an MCH in gynecologic oncology to treat purely cancers of the women's reproductive tract, especially gynecologic oncology, because this is a field where there is a lot of demand meeting gap. As in gynecological cancers are one of the most leading causes of cancer deaths among women in India. However, specialists who are trained in it to deal with gynecological cancers are far and few. So to meet this demand, there needs to be a huge provision for doctors, and that is one of the main factors that inspired me to take up this particular specialty of medicine. And of course, the happiness that or satisfaction that we get out of treating people in their most labile periods of their life is something else. To be able to support them, to give them the best of care, is really life satisfying for life. And of course, as a surgeon, the ability to be able to do the most difficult surgeries is also quite satisfying. Now, coming to what are the treatment options or what are the particular cares that we do provide in Cytecare. Yes, in addition to screening patients for the various gynecological cancers, including ovarian cancer as well as cervical cancer through pap smear, imaging and blood tests, we also provide the HPV vaccination for those who fit the criteria for the vaccination, and which significantly is a major factor in controlling cancer, because as we all know, prevention is always the best form of cure. So preventing cancers is the most cost-effective way of controlling cancers all over the country. So the screening and vaccination is something which has to be very much stressed on, and which we provide easily, and we counsel patients completely about what is the need for screening and vaccination, and most of the time we are able to convince patients to go for them. And coming to the surgical aspects of care, we treat all the cancers of the reproductive tract, as I have already mentioned. We provide what is the latest in technology in terms of minimally invasive surgery, laparoscopy as well as robotic, and even the more later advances as an intraperitoneal chemotherapy, which is a particular form of treatment wherein during surgery we provide chemotherapy into the patient's body cavity, so that the chemotherapy can immediately act upon the remaining cancer cells after a particular surgery. In addition to non-cancerous, to these cancers treatment, we also do cater to women of any age group who have non-cancerous conditions such as fibroid uterus, adenomyosis, endometriosis, even medical management of hormonal imbalance situations such as PCOS. The only section that we do not really cater to are, of course, pregnancy-related and MTPs and abortions.